she was born? Did she have any signs of autism?
Well, she did. So first, I'll tell you, I was on immunosuppression because I had my kidney transplant at age 13. So, and I only had one kidney because they had removed both of them. So some of my doctors didn't want me to be pregnant. Some of them said it was okay. I was most concerned about being on the immunosuppression, passing, the medications down to my baby. So we chose to have a surrogate carry the girls. So we went through IVF. She got pregnant with twins. And when she went into delivery, she decided to have general anesthesia. So, not my body. So that was difficult. Her doctor told me no big deal. The second one out will just be a little groggy. So that happened to be Tula. She was groggy. She was having a little bit of difficulty breathing. So the doctors wanted to put her on a round of preventative antibiotics. I believe it was the first couple days of her life.
I want to just interject here, Holly, that in the baby boomer generation, that's how babies are born.
Yeah.
Their mothers were, they guess they didn't want to feel any pain, modern mothers, and so they were put to sleep.
Right.
So a lot of babies, I'm sure I was one of them, were born, and when for a couple of weeks, they were really groggy. They, today's baby, I had, my kids were born naturally, so they were immediately present, looking around, they were amazingly different.
Yeah.
But that's not done very much today, so that's definitely a strike against a newborn.
Exactly.
And why did they put her on the antibiotic, though?
It was preventative, just in case she got a lung infection. She was fine. But, I had grown up in and out of hospitals and clinics my whole life. I'd always just listened to doctors. I never questioned. So she was on antibiotics. Brought the girls home, and the surrogate was kind enough to pump some breast milk for us. So the feedings, though, did not go well with Tula. She would kick and scream, and I'd have to massage her to get any milk down. She was diagnosed with reflux by her pediatrician, was put on medication, told us to switch to formula. We tried, I know, we tried.
That's so common today. I'm
Yeah.
constantly talking to new moms who they didn't maybe produce enough milk, they thought, and that's the first thing the doctor says to do, or they try it themselves. They go on a formula, and there's not really a good formula out there. So,
Right, right. So we were switching formulas and finally came, we found one that helped her a little bit, but I was not used to looking at nutrition labels back then. And the first ingredient was sugar. So she was on that formula for a long time. So born C-section, did not get the beneficial bacteria, was on antibiotics actually many times because that first year her sister would get a cold and she would get pneumonia. And she had all these rounds of antibiotics for ear infections. I don't even know if they prescribe antibiotics for ear infections anymore, but it was about 3 times her first year. And no breast milk. So, there are 3 strikes right there.
can I again interject a little bit of interesting information because we know more and more about the microbiome and how it's formed at birth and all. The first 3 months, the digestive tract in a newborn simply isn't working. It's even difficult for the newborn baby to digest their mother's own milk. And there's very little protein in milk. They've just got the whole formula thing completely wrong. But anyway, it's not unusual for the first 3 months for babies to spit up and have quote unquote reflux. But mothers don't know that. The doctors don't either, I guess. And so they think, oh, he's spitting up and, so he's not digesting my milk. But that inner ecosystem is trying to get established. And when it is in 3 months, things start going much smoother. So back to what you were going through. In the meantime, we had another little girl to contrast
Right.
Tula's, health, basically her digestive tract and everything. And so, was there a big difference between the two girls? And
There were. Tula was having diarrhea, where her sister was not. Tula, she looked unhealthy. She would have hives. We never found the culprit. She had dark circles under her eyes. As she grew, she was very thin, but with this distended stomach. And then started the behavioral symptoms. So she started stimming, like hand flapping. She had echolalia. So I would ask her a question and she would either repeat it to me or her answer would be about Mr. Noodle, a character from Sesame Street. The cradle cap. So I just thought all babies had cradle cap, and for some reason hers was worse, and she had it till she was about 5 years old. And it was
wow.
yeah, it was so bad that we would have to use a toothbrush in the bath to try to get it off. And,
It's real common today. I want to interject this too. That's a biotin deficiency, and yeast. They consume the biotin because it helps them grow. If you get rid of the biotin, then they can grow and develop these tentacles to, get themselves established. So it's if a child is born with cradle cap, they are deficient in biotin. I think biotin is one of the many important supplements some moms should be taking. But of course, moms are not told that they do need to eat a certain way. Their yeast infection will be themselves. And of course, if you were, in and out of the hospital as a teenager and so on, having a transplant, a kidney transplant, they would have had you on antibiotics as well. So mothers today have yeast infections. It's just prevalent. And also your immune system's naturally suppressed. Your progesterone and estrogen goes up a lot. Glucose goes up a lot. That feeds the infection, even if she didn't seem to have a problem with it before. So I think one of the causes of autism that no one ever brings up is that our babies are being born with a yeast infection. So what you're saying is exactly confirmation of that, basically.
yes. So yeah, she tantrumed. She was just unhappy. She was very anxious. And I was very scared because before the girls were born, was an academic therapist at a children's hospital. So I had worked with lots of kids with autism. And to me, it was like anything but autism. So a diagnosis really scared me. So we finally got her evaluated. She was diagnosed on the spectrum. But when it's your own child, I was taught that there's nothing you can do for autism. I just started researching. And I found a group called TACA, TACA, that talk about curing autism. I think the acronym is different now. But a doctor was slated to speak that night. So I went to see her, and she talked about autism as a GI disorder and talked about that there's tests that you can get done through the Great Plains Laboratory. So I ordered up the stool analysis and the organic acid test and got those samples, sent them off, got the results. I didn't really know how to read them, but I did notice that her yeast levels were off the charts. She didn't have any good bacteria. And the minerals and the vitamins were really low. The oxalates were high. So I needed to find a doctor locally that could help me with this. So we saw one that works with autistic kids in a more holistic way. And he did his own labs and he said, okay, we just need all these supplements. So we had so many supplements, we had a big spreadsheet on our fridge, and went back a month later and nothing had changed. The vitamins and minerals hadn't changed. So he said, well, we need to double the supplements. Doubled them, month later, went back, they had dropped. So nothing was working. And I remember the nurse saying to me, you know, these kids just need so many supplements that their body just sucks it all in and they need more. And it just didn't make sense to me.